You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
The rhinoplasty consultation process starts me asking the patients to tell me about their sources of discontent. What is that they don't like about their noses? And obviously that's the beginning of the understanding, because if they see something that I don't agree with it, we are on the wrong page. So that's the beginning. That rarely is the case. Almost always, they see what I see, and I see a lot more. So after I listen to the patients, we are actually, before even they come to see me, they complete a functional form, 2 pages of functional form about their breathing, their headaches, their migraine headaches, and how often they wake up in the morning with the dry lips, things like that. That is going to help me to decide whether there is an underlying functional issue. And then when I sit across the patient, as I mentioned earlier, I watch their faces while they're talking, while I'm talking. I'm watching their faces to see if their lips are closed in a relaxed position and repose. Then I, step by step, analyze the face and the nose, because again, the nose has to match the face, and record it in in a computer file. Then I'm close to the patient and examine the inside of the nose. And then I discuss with the patients, what are the things that I see? And commonly their complaints are 2 or 3, concerns are 2 or 3, but I'm going to point out at least 10 or 15 areas where I see flaws. And then I discuss the course, so what is going to be happening, how we do the surgery, and whether this is commonly, actually, I'm doing this through a virtual consultation, because that's where most of my patients come from. But I also have a lot of local patients. If the patient is not sitting across me, I'm watching them on a video. And the out-of-town patients come in town only 1 day before surgery. We do the surgery the next day, and they go home the following day. So they don't stay in town, as I mentioned earlier. And on in-town patients, I finish the conversation. We take the life-size pictures and start working on it. It takes a while to prepare the pictures. And most patients come back for a second visit, which is a pre-op visit. And during that visit, I show them the life-size pictures and discuss with them, make sure that, again, we are absolutely on the same page before we go to the operating room. These are life-size pictures that we obtain, my photographer obtains. And we do have a software, in-house software that is developed based on studies that I have done, and also craniofacial principles, that some of those have been around for 400 years. But I put all of those together and created a system where we go through 16 steps to get to an endpoint that gives us an outcome and a drawing that shows how much change we need to make where to create a nose that goes with that face. Again, it's relative to the forehead, lips, chin, cheeks. All of those make a difference. And what was that we're going to be doing with the nose? There's no extra charge for it, even though that's the most time-consuming part of the analysis. But in my view, it's a requirement. I have never done a nose surgery without life-size pictures and analysis, unless it's a minor revision. Unfortunately, in this analysis, we cannot demonstrate what the nose is going to look on the front view perfectly, but we show the profile changes down to 1/4 of a millimeter. On the front view, mostly we are focused on the direction, width, and symmetry of the nostrils, and those are the things that I discuss with the patients. I clearly indicate to the patients that this is a drawing, results cannot be guaranteed, but if they want, they can take a picture, take it home. I can't give the pictures to them because I'm going to be using it in the operating room. They're sort of my blueprints, but they can take a copy, a picture of it, and replay it at home and look at it as long as they want. Patients who are from out of town, they come early in the morning so we can prepare the pictures, and I meet with them in the afternoon to go through the same process. And then they go to the surgery the next day, those out-of-town patients. Or in-town patients who have scheduled the surgery, I see them a couple of weeks before just to make sure that we're on the same page, as I mentioned. And that's a crucial part of rhinoplasty success, being on the same page, having matching goals. And then we go to the surgery the next day for out-of-town patients, or in a couple of weeks for the patients who are from in town. And those individuals go to the recovery room, then go home afterwards. Or the out-of-town patients go to the recovery room for an hour or so, then go to the hotel. I see them the next day, they'll go home. If anyone is interested in a rhinoplasty consultation, you can call our clinic, Ziba Clinic, 440-461-7999. Again, 440-461-7999. Or you can go to my website, drbahmanguyuron.com. And you can actually make your appointment through the internet. We're here to serve the patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.